We have been treating patients throughout the pandemic. The radiotherapy and the systemic therapy, the chemotherapy has continued, but we noticed that the number of patients who referred to us dropped. Me and my colleagues are really concerned that people with the best will, both themselves and community, the wider community, are sitting at home with symptoms of blood in the urine, or coughing up blood, or a new breast lump, or pooing blood. These symptoms, if they go on for too long a period of time, cancer treatments become more complicated, more difficult, and mortality drops.
If you've got anything that is quite untoward, and we all understand about our body, and if you think that something has changed, if you just sit and wait, things will not get better. So if you have got a lump, if you have got significant new diarrhea, if you cannot swallow food, you get seen because you have a responsibility to yourself. If somebody has got cancer, then that's bad. Only thing that is worse than that is that you not knowing it and the doctor not knowing it. Denial does not cure cancer. And cancer doesn't wait for the coronavirus pandemic to finish.
September last year, I think they just launched a breast cancer awareness poster, and it was about checking yourself and things like that. So I checked myself and I found a lump. It just didn't feel right. They acted really quickly with the operation, and I'd already had the date to start my radiotherapy at Barts, and that was the same time as the height of the COVID. So I was wondering, but unfortunately I went in on the I think it's the 20th of the Monday. So when everyone started the lockdown, that's when my treatment started. I was very nervous, so they reassured me, because obviously it's a new process, you have to relax, and they really played their part. It was really, really good. You know, I can't thank them enough.
I had a regular mammogram screening 5 years ago, but I had just started a new job, and I was a bit self-conscious about taking time off in the middle of the day, and thought, I'm not going to go. And I just happened to say it to a colleague, oh, I've got this appointment, I don't think I'll go. And she said, but you must, it's really important. I was diagnosed with breast cancer 5 years ago, but it was caught very, very early. I can't stress enough how important screening is. Going into a screening when COVID's around was not just sort of going through sliding doors and ambling upstairs. There was a lot of detail that had gone into making the waiting room safe. The chairs were 2 meters apart and they were positioned facing different ways, and I was seen within minutes. It was the quickest appointment I think I've ever had. And what they've said is I'm clear, and so my risks are no greater now than any woman of my age.